Good afternoon, Dr. Laposata.
6 minutes till the afternoon. Good afternoon.
That's okay. You wrote a report in this case, doctor?
Yes, I did.
Do you think that based on your analysis, was Mr. O'Keefe thrust backwards? Is that what you determined looking at his head injury?
That he was, I didn't understand you had your hand in front of your mouth.
Sure, I'm sorry.
Yeah.
You talked about a head injury that Mr. O'Keefe had, that
Yes.
he suffered from,
Yes.
that caused his death.
Yes.
Was that caused by being thrust backwards?
Yeah, the motion was upwards, down.
Okay. And the way you just showed it could be a fall.
Correct.
Did you have an opinion looking at his wound that he was thrust backwards?
What do you mean thrust?
Well-
His body went backwards. There may have been some applied force to it.
I don't know about thrust. I'm asking if you have an opinion. Your words. Do you have an opinion about thrust?
What do you mean thrust?
Did the forensic pathology diagnosis mean Mr. O'Keefe's body was thrust backward?
If you want to say thrust as indicating movement, that it went backwards, then you could say it was thrust.
Okay, may I approach?
Yes.
I'm showing you page 2 of your report, Dr. Laposata.
Yes.
I'm just going to ask you to read it, not out loud, and then I can ask you the question after you take it. But I want to
Yes.
take a look.
Yes.
Are you familiar with that?
No, absolutely.
So, Dr. Laposata, what did you mean when you described that Mr. O'Keefe's body was thrust backward from a standing position?
I mean that he was standing upright and his body had momentum and went down and hit at the back of his head. So it was thrust backwards.
You cannot tell forensically how much momentum he had, can you?
No, we don't do those analyses.
And you can't tell if anything caused that momentum based on the head injury, can you?
What do you mean causative? It was caused by his body went backwards.
Yes. And so the amount of force causing him to go backwards, that's not something you can determine from the head wound, is it?
No, I can't tell you the amount of force. It was significant because he had the massive skull fractures.
Did you say it would be significant?
Yes, significant force.
In modern medicine, there are a number of different machines that can help us see the brain, like a CAT scan, perhaps,
Sure.
MRIs.
Yes.
Would you agree with modern medicine that the use of MRIs and CAT scans and other tools give a clinician equal, if not better, opportunity to examine the brain as actually cutting it and holding it in your hand?
No, the actual gold standard is the pathology, to be able to have the brain in your hand, look at it with your naked eye. And we have conferences in the hospital where we meet with radiologists and say what we find at autopsy and see if their radiology was correct.
Can CAT scans and MRIs show contusions on the brain?
Well, they might.
Subdermal hemorrhages?
Subdural hemorrhages. Yes, they can.
Herniations?
They can.
Do you have any doubt about the modern medicine and the use of MRIs and CAT scans? Do you think they're inadequate in any way?
Well, I'm not a clinician, so I don't use those to diagnose diseases in living patients.
Dr. Laposata, have you ever had any experience studying the brain in real time, clinically, going and opening somebody's skull and treating the injury before the person dies?
No, I'm not a neurosurgeon.
You don't have any neurological expertise, do you?
I'm not a neurologist. I'm not a neurosurgeon. I'm a forensic pathologist.
Do you have any clinical experience at all where there's an acute head injury and you're making an effort to observe it and analyze the injury as it progresses in an attempt to save the person's life?
I don't treat or diagnose living patients.
I understand, but as far as your background, have you ever had any experience, clinical experience, showing the progress of an actual brain injury and trying to treat it?
I understand the physiology of what happens to the brain when it is impacted by something, whether it be a bullet, a boulder, a fall. So I know what happens to the body to cause the changes from that trauma. I don't treat people for those injuries.
In observing a brain that's in trauma and making determinations of how long it's viable or whether the person will expire, do you know the process that a neurosurgeon would go through in order to fight to preserve the person or save the person? Do you know the step-by-step process that they would undertake?
To do what?
To try to operate or save somebody from a head injury, from a brain injury.
I'm going to allow it because of politics.
Well, it depends on what the brain injury is. If you have head injury and you have bleeding on the brain that's pushing the brain one way or the other, it would be a subdural. Then a neurosurgeon would come in and try to take that blood away so it doesn't compress the brain. So that's something that neurosurgeons do to treat head trauma. They can also put in drains into the ventricle of the brain, and that can relieve pressure in the brain because that brain swelling is a bad thing. So those are some of the things neurosurgeons do to treat brain injuries.
And can they remove part of the skull to relieve pressure?
Oh yes, they can do that. It's called a craniotomy. They can take out part of the skull if they need to.
So there are a number of different steps that a neurosurgeon can take when someone suffers acute brain trauma to try to save the person, isn't there?
Well, the job of any doctor is to try to save a human life if you treat living patients. So certainly a neurosurgeon would evaluate the patient and decide if there's any treatment needed that could improve the patient.
When you've had cases in the past as a medical examiner where there have been issues regarding brain injury, wouldn't you agree that you have sought outside consultation with people who have a higher degree of specialty in brain injury than you?
Sometimes what we do is when we're examining the brain, we can call in for a conference and have a neuropathologist come in and review the brain with us.
And back when you were a medical examiner, you did that on a number of occasions, didn't
Yes, that's routine.
The reason why is because there are different specialties in medicine, and some are different and separate than your specialty, correct?
Of course.
In a neurosurgeon or a brain surgeon, it would be a different specialty than yours.
Yes.
And they're focused on the brain, yes?
A neurosurgeon does brain surgery.
And so, how many times in your career do you think that you've assisted the help of neurosurgeons to take a look at brain study to help you?
I've never needed to speak with a neurosurgeon to look at a brain. Sometimes we call in neuropathologists and we have a forensic neuropathology conference where we look at brains with the interns and residents.
How often would you call a neuropathologist?
Maybe once a month we would have a routine conference.
And again, the neuropathologist that's dealing with a person's brain after they're already died.
Correct.
So it's not a clinical setting or a clinical experience of actually watching the brain at work and seeing the injury as it progresses.
We don't do neuropathology like that on living people. The person is deceased.
You had an opinion to the jury today, and you said that you believe that Mr. O'Keefe died within 15 minutes?
Yes, I think that process would start within 15 or 20 minutes.
Is that to a reasonable degree of medical certainty, that opinion?
Yes, based on the severity of the injury and the brain swelling.
You're aware that there are numerous level 1 trauma centers around the country that deal with brain injury, right?
Sure.
And the idea is that people suffer all types of brain injury, and if they are given medical attention in a reasonable amount of time, there's a chance they can be saved, yes?
Well, it's possible, but many are so severe that they cause death no matter how fast they can get medical attention.
In fact, every day when people get the right attention or proper attention, they're brought to level 1 trauma centers around this country to try to help them or save them. Isn't that fair to say?
I would hope so.
Do you think?
Sure.
When you looked at Mr. O'Keefe's brain, obviously it's after he already expired, correct?
Obviously,
And
yes.
so you didn't have any clinical observation of the progress of his injury that night, did you?
I was not observing him. I did not observe how he got his injury.
When you gave an estimate or you give an opinion about how long he was alive for, are you aware that there's certain tests that are done by neurosurgeons when people are suffering brain injuries but there's an attempt to save them?
Sure.
Have you ever heard of a Guzman coma score?
Glasgow, you mean?
No, this is Glasgow, but have you heard of Guzman?
It's called Glasgow Coma Score.
Have you ever seen the assessment that a level 1 trauma center goes through when they're trying to save somebody with a brain injury?
I'm generally familiar with the emergency procedures to save somebody's life.
Have you ever read any statistical studies attempting to correlate the brain injury with the time somebody would live for?
I'm aware of that, and I see that in my practice of people who have survived brain injuries and die of something else. Then I can look at the brain and understand how the brain can heal or react to injuries.
And many people who suffer coup contre coup will go into a brain surgeon center, and many of them pass after time, don't they?
Now, every case is different.
Right. Some might live for an hour, hours, weeks, months, or survive the injury. Isn't that fair to say?
It depends on the case.
In this case, you don't have any objective criteria to identify the amount of time Mr. O'Keefe would have lived if he had the appropriate help. Isn't that fair to say?
I don't think it would have been effective because there were massive skull fractures to the base of the skull, and there are cases where the amount of force and energy applied to the head, causing skull fractures, breaking the neurons, causing the brain swelling, despite rapid medical treatment, those people cannot be saved. They can't effectively stop the brain swelling.
Many people can't be saved. Did you know that about 1/3 of them do get saved?
I don't know what you're talking about. 1/3 of everybody has different sorts of injuries. 1/3 of what?
With a Clivus fracture, coup contre coup. Are you aware that 1/3 of those patients survive if they get the proper treatment?
It depends on the amount of force.
Okay. Are you aware that a study would show, have you ever read a study by Isaac Wolf on Clivus fractures?
No.
Have you read any studies on Clivus fractures?
Clivus fractures? Yes, I understand what Clivus fractures are. It's a part of the base of the skull.
Okay.
And
And have you,
Oops. Okay, go ahead.
please, did you want to say?
No, you go ahead.
Oh, I'm sorry. Have you read any studies that tell you with the proper treatment, despite these potentially catastrophic injuries, that 1/3 of patients can survive?
No, but that's not the case we have here.
And so in this case, I asked if you had any objective criteria. You don't have any objective criteria about the progress of Mr. O'Keefe's wound that can be a basis for you to conclude that he would have died in 15 minutes. Isn't that fair to say?
No, I understand what happens to the brain when it gets that sort of injury. I understand the time course and the physiology, I've seen hundreds of individuals who've had brain injuries. Some survive for a longer period, some die earlier, and it depends on the amount of force and the amount of brain swelling. And in Mr. O'Keefe's case, we had the massive skull fractures of the base of the brain and immediate swelling and subarachnoid and subdural. So he had a large force applied to his head, which caused the brain swelling and the and the progression of the brainstem down through the foramen magnum that stopped the brain. It was a very forceful impact.
You examined his brain after you looked at photographs. You can't tell us objectively when his brain swell started.
It started immediately after impact.
And you can tell us what the progress of that brain swell was by looking at his post-mortem photos.
By looking at the post-mortem photos and the post-mortem examination, I can tell the degree of force from the extensive skull fractures that were present.
What was the degree of force?
It was medium to large.
Well, that's a wide range. What do you mean? Quantify medium
So I'll
to
strike
large,
the comment,
please.
ask the question, Mr. Brown.
What does medium to large mean?
Enough to cause a lot of fractures to the skull. He didn't just like sit down and lie down.
If he sat down and lied down, he probably wouldn't have fractured his skull, correct?
That's obvious, yes.
Right. And so when you're telling us you can identify that he immediately died or died within 15 minutes, I'm asking you for objective criteria. For you to give that opinion, I'm asking you what objective information you have. And so you said that there was a large amount of force, correct?
Sure, but because there were massive skull fractures and there's a lot of energy transmitted to the brain, starts swelling immediately.
How do you know this wasn't medium force and not large force?
Because of the extensive number of skull fractures.
So are you saying it was medium or large force?
Medium to large.
Okay. How much force is that? Can you quantify it?
No.
What other objective criteria do you have to support your opinion that Mr. O'Keefe died within 15 minutes?
With my training and experience of seeing thousands of deceased people from head injuries and knowing some of their clinical course when they get immediate medical treatment, they don't survive.
But you would agree many do.
Depends on the case.
And in this case, you didn't have any opportunity to observe the progress of Mr. O'Keefe's injury that night, correct?
I'm going to allow that.
I wasn't there. The body told me what happened to it.
You have no assessment of the development of his brain injury and how much time it took that night, do you?
I do, from understanding the significant skull fractures and the swelling of the brain and the compression of the brainstem that all happened very rapidly because of the amount of force that caused all those skull fractures on the base of the skull that actually then hemorrhaged into his upper eyelids. That's a large amount of force.
Was gross edema found on his brain?
I think it was swollen, yes.
But was that a finding?
Yes.
Where did you see that finding?
Well, in order to have the herniation of the brainstem, the brain swells.
Where did you see that finding?
I can't answer that. I just know it from understanding, looking at the pathology.
So at the end result, at some point, Mr. O'Keefe had gross edema.
In order to get the brain stem hemorrhages, the only way you get that is because the brain has swelled. And there's no, after injury, tissue swells, and there's no place for the brain to go when it swells except down into the natural hole in the bottom of the skull where the spinal cord goes down. So that's where the pressure goes. So that seeing the brainstem herniation tells you that the brain has swollen a lot.
Undoubtedly, but it doesn't tell you when it began to swell or the progress of that swell, does it?
I don't know what you mean.
You see inevitably because of the swelling, there's the suffocation, but when you see that, you don't know when the swelling began or how quickly it progressed. You can't tell that from an autopsy.
Yes, you can, because of the severity of the skull fractures. I know there was a lot of force, and that force applied causes you to go unconscious, then your brain swells. If there was just like one skull fracture, then that's a little bit different. But this was massive skull fractures on the base of the skull. So there's a lot of force applied. So I know because there's a lot of force applied to cause the skull fractures, that the brain would swell rapidly.
You would be unable to identify the rapidity of the swelling if you don't know the amount of force. Isn't that fair to say?
Well, I do know the amount of force because of the amount of skull fractures.
In what you know is, in your words, medium to large force.
Yes.
You've heard of periorbital ecchymosis,
Yes.
and that's sometimes called raccoon eyes.
Well, periorbital ecchymosis just means bleeding and bruising around the eyes.
And you saw the bruising around Mr. O'Keefe's eyes, didn't you, in the photograph?
Well, it wasn't bruising caused by blunt force trauma to the eye. It was bleeding in the upper eyelid because the plates above the eye and the base of the skull were fractured by the brain hitting it. So, and that's a result of basilar skull fractures and not the application of force directly to the eye.
Would you agree it takes a few hours for the bleeding to accumulate in the person's eyes?
No, as soon as you break the skull bones and the heart's pumping, the blood comes out of those injuries. And it starts to accumulate right away. It starts within minutes, you can see it.
So you would disagree with the suggestion that it takes at least 1 to 2 hours for that bleeding to occur in the eyes. You disagree with that?
I do disagree with that. It starts immediately.
Do you have any studies that you've relied on or literature or support for that?
I understand the physiology of what happens when you get those skull fractures and the density of the blood vessels. And if your heart is pumping, you pump the blood out those broken blood vessels into this small area above the eye. And it can happen within minutes.
Do you have any studies or literature to support that?
It's my training experience. I can't cite you a particular article at this time. I could certainly go look it up and bring it to you.
Okay. Let me ask you questions about the wounds to the back of Mr. O'Keefe's head.
Yes.
You see a linear abrasion?
Yes, vertical lines, yes.
Now, would you characterize this as a classic wound caused by falling backwards and landing on your head?
What do you mean, every wound is different.
Every wound is different?
Sure, every person's different. Every way you get injured is different.
And so if somebody falls backward on their head and suffers the basal fracture, the wound, from your perspective, can look different.
It depends on the impacting surface.
Wounds on the same surface, say two people fell on the same surface, could they have different wounds on the back of the head if they suffered the same injury?
In theory, if they fell, if they rotated their body, if you could reproduce something exactly, then you would see the same wound patterns.
This wound pattern is typical of falling backwards on a hard surface, isn't it?
We know it's from falling backwards and striking something hard.
Can the frozen ground be hard?
A frozen ground can be hard, but it doesn't fit the pattern in this injury.
We'll get to that, but is it
okay.
hard enough to cause a basal fracture?
It can cause a skull fracture.
The frozen ground is different than a sheet of ice, right? It's not smooth and flat like a sheet of ice, is it?
Well, it could be, I guess.
Okay. You mentioned there's some granular patterns in this wound.
Yes.
Didn't you?
Yes.
The area in front of 34th Fairview, the frozen ground, do you know if there was any impediments in the lawn that was frozen?
In the what? Oh, the lawn?
Yeah. Yes. Sorry.
Yes, I saw the scene photographs of when the snow was removed, and it was like winter lawn grass. So it was some green, some brown. It was pushed down, and like straw that was going different directions, which wouldn't give you that pattern.
Did you see the exact area where Mr. O'Keefe last moved?
I saw that general area, and there were a lot of photographs, yes.
You say general area. Can you tell us that you saw photographs of the spot where Mr. O'Keefe was lying when he was found?
Yes, that general area.
Could you see the ground where his head was? Can you identify that?
Yes, with the scene investigation, they shoveled the snow off of that area.
And you had never had a chance to go out to that scene yourself, did you?
No, I just looked at all the photographs.
You cannot see what's under the grass and the dirt, can you?
Well, dirt's under the grass.
Well, do you know if there's any rocks or impediments or bumps?
It was a smooth surface covered with grass.
It was a smooth surface? The front lawn was a
It
smooth
was
surface?
a flat surface
Flat.
covered with grass.
Okay, and do you know what was under the grass, whether there was any pebbles, rocks, debris?
I didn't see any.
From the photo.
Correct.
But you don't have any first-hand knowledge that exact area where he ended, what the turf was like, do you?
I saw photographs of that lawn where they removed his body from.
So you're relying solely on the photographs, is that fair to say?
Correct.
Do you know if Mr. O'Keefe was wearing anything that could cause abrasions when he landed to cause that scraping pattern in addition to the linear abrasion?
He did have a baseball hat on, but that would not cause that pattern.
The area of the abrasions, is that in the area of the level of where a baseball hat would be on the back of somebody's head?
It could be.
Could be. If somebody hits the ground and falls backwards, can they slide?
If they're on an incline,
What if they're thrust?
well, if you fall backwards and you fall backwards on an incline, your body might move.
Well, what if you fall backwards on flat ground? Does the body, can it move after it falls?
Not really, maybe a little. If from the momentum of the impact, it might move slightly, but not really.
So when a person falls backwards and lands, you don't think their head has any room for movement?
Not significant.
Well, not significantly, maybe just a quarter inch, half inch.
No, it's possible.
And did you see the scrapes around the wound of Mr. O'Keefe's head?
Of course I saw them, yes.
And they're within, what, about an inch?
What are you describing? What part? Are you describing the tearing, the laceration of the scalp, or the vertical abrasions?
The vertical abrasions.
There were maybe an inch and a half.
Inch and a half? Do you think that if someone fell backwards and landed on their head, they could move an inch and a half?
Well, he landed on something that had a ridge on it to cause the laceration in the scalp, and then with a little bit of movement, those vertical scratches were caused by some kind of like pebbly-like surface.
You mentioned that the orbital bones were broken and you had opined that it was caused by the brain. Do you agree that a brain is very soft, consistent with, for example, tofu?
Oh, gross. What do you mean? It is soft.
Is it that soft? Is that the texture of
Well,
it?
it depends on what kind of tofu you have.
Okay. Do you think that the orbital could have broken when the break on the back of the head split the skull and then would cause the orbital break instead of the brain?
The orbital plate fractures, if you look at the base of the skull after you take the brain out, you can see the fractures go up from the back to the front and to the orbital plate. Sometimes when you fall backwards, the brain can also slap those orbital plates and cause some damage, but I could trace the fractures from the point of impact along the base of the skull to the part of the skull over the eyes.
Do you think the base of the skull break, when it separates, could have caused those orbital fractures?
I don't understand your question.
Okay. When Mr. O'Keefe incurred that head injury,
Yes.
the basal fracture, do you think that the pressure, the damage from that basal fracture, the separation, could have caused the orbital breaks in his eyes?
Well, the fracture of the plates above the eye, when the blood is still pumping, there's a space there where the blood can come down into the upper eyelid.
So you described the brain as causing that break. I'm asking you, could it have been from the basal fracture, from the skull fracture?
Yes, the fracture that was caused by the impact to the back of the head, radiating to the front of front of the base of the skull.
So when you told us on direct it was from the brain that caused those fractures, was that just a summary, or is that to a reasonable degree of medical certainty?
Well, sometimes the brain can also, in a fall, flap and hit those, but in this case, I could also see that the skull fracture started at the back and came to the front, but it could also be contributed to by the brain hitting those delicate bones.
I guess my question is, when you provide the opinions generally of what you believe and what you've seen, are these general opinions, or are they actually specific opinions based on the facts of this case?
They are opinions based on my examination of this case, but all that's based on my 40 years of training and experience.
But when you told us about the brain causing those orbital fractures, you would agree with me, at least now anyways, that it very likely could have been the basal fracture that caused those breaks.
They're both.
It could have been both?
Sure,
Okay, could it have been just the basal fracture?
that's possible.
When you offered the opinion to a reasonable degree of medical certainty, had you considered the basal fracture as the source of those breaks?
Of course.
Is there a reason you didn't share that with us and you just said it was the brain?
I had no reason not to share it.
Okay. Was there any depressed fracture to Mr. O'Keefe's skull?
No.
Can you tell us a little bit about a depressed fracture? Depressed fracture is different than what we saw with Mr. O'Keefe, isn't it?
A depressed fracture is when something fractures the skull and then pushes the skull and moves the skull inward. This just had a fracture, but it didn't move the skull inward.
And you've seen depressed fractures in your practice over 40 years, did you say?
Of course.
In those 40 years, depressed fractures can happen from sharp objects,
Sure.
pointed objects.
Sure.
Someone hit a person in the back of the head with enough force, with like a hammer, for example. That could leave a depressed skull fracture, couldn't it?
Certainly. You can hit somebody on the head with a hammer and cause the fracture, and then the continued force will move that fracture into the brain.
There was no depressed skull fracture in this case, was there?
Correct.
You gave some opinions today about you gave some opinions about wounds on Mr. O'Keefe's arm. I'd like to talk to you a little bit about that.
Sure.
Could we have that photo brought up, please? Do you see all of those superficial abrasions?
Yes, I see patterned injuries.
Right. Would you agree that they're superficial abrasions?
Yes, they go along the skin surface.
How many punctures would you identify in that photograph?
Let's see, there may be some punctures like around the elbow, consistent with the teeth puncturing. Most of them are the teeth scraping along the skin.
I'm not going to ask you what you believe the cause was. I'm going to ask you just about the wound. How many punctures do you see?
Well, this doesn't show. There are other photographs which show more of them, but there's the little dot-like areas. You could call an area of skin puncture.
Can you tell us from this photograph how many punctures you would say are in that photo?
I didn't count them.
Well, did you suggest that there was more than one puncture on that wound?
I think I see more than one. Yes,
Pardon me?
I see more than one on there.
Okay, could you give us a count of how many punctures you see?
Well, without looking at all the photos, I couldn't give you a correct number.
Okay. You've written a report, haven't you?
What?
You wrote a report,
I did.
and in your report, you describe many of those abrasions as punctures, don't you?
Yes,
And a puncture isn't just a scratch. A puncture is a penetration of the skin, isn't it?
yeah, a point-like penetration.
A puncture has a very specific medical meaning, doesn't it?
Yes, it's a point-like penetration of the skin.
And according to you, there are many punctures in that wound.
Yes, I can see 1, 2, 3, 4, 6 or 7.
Can medical professionals disagree on opinions about wounds and causes?
I suppose they can.
You also gave some opinions that you did not believe that Mr. O'Keefe's scratches were caused by having some impact with broken pieces of plastic or glass, correct?
Correct, they weren't caused by that.
Broken plastic or glass can cause a number of different angled wounds, can it?
It causes an array of irregular, random injuries.
It can have infinite different patterns, couldn't it?
Could.
There's nothing to hold a wound from a broken shard to be north or south or east and west. It all depends on how the force was impacted on the body, true?
I'm not quite clear on your
Okay,
question.
I'll try to do better. When you're talking about shards of broken glass or broken plastic, there is no set direction that they may cut somebody, is there?
Well, it would depend on the case and how those occurred.
It can happen in many different forms as far as depth, yes?
Well, anything's possible.
How about length?
What about length?
Wouldn't that change? Couldn't that change depending on how the injury occurred, the length of the wound?
Sure.
And in this case, you talked about your opinions of injury relative to a motor vehicle, didn't you?
That was something I considered.
It's something you considered. Did you know much about the details of the motor vehicle in this case?
Yes.
Okay. When you considered your differential diagnosis, did you consider whether there was any DNA on the vehicle?
I didn't look at any of that.
I'm sorry?
I did not look at any DNA.
Do you know if there was any hair on the vehicle?
I don't know.
Did you consider the scene itself where there may have been a debris field? Did you take a look at the debris field in this case?
I know there were photographs of various pieces of plastic around the area where the body was found.
And do you remember where those pieces were found?
Somewhat, yes.
Did you have an opportunity to consider other evidence like a shoe in the area near where Mr. O'Keefe was found?
I know one shoe was on his foot at the hospital, the other was at the scene.
Do you know if his hat stayed with him after he landed on the ground?
The hat was in the area where his body was found.
Did you take a look at his pants, the back of his pants?
I looked at that, yes.
Okay, what did you see when you saw the back of his pants?
Well, because he had bled from the back of his injury and he was on a hospital gurney, some of that blood came down, so some of the blood was on the back of his pants.
Did you see anything else other than blood on the back of his pants?
I don't remember.
I'm sorry?
I don't remember if I saw anything else.
Did you look, when you were doing your differential diagnosis, did you look at any evidence other than physical evidence? Did you look at any data evidence?
I don't know what you mean, data.
Like data you'd find on a cell phone?
No.
Did you look at any of the data evidence from the defendant's Lexus?
No, other than looking at the contours of the back to see if it had impacted Mr. O'Keefe.
When you were doing differential diagnosis, did you look at any information that would tell you what the speed of that impact may have been or allegedly was?
Well, it didn't hit him, so it doesn't matter.
Okay. So you didn't care to know? anything about the car, the data in the car, because you had already formed your opinion?
It did not hit him, so it was not relevant to my opinion.
Is that a different way?
By looking at the body, I could tell that there was no evidence of impact with the vehicle. So whether the vehicle was going slow or fast is not relevant.
And so you didn't try to get any information about the speed of the vehicle? It was totally irrelevant to you?
Correct.
And did you also disregard, well, let me ask you, do you ever look at statements?
I look at witness statements if they're available to me.
Were any of the defendants' statements made available to you?
I did hear some of them.
Did you consider the ones that you heard?
Of course.
Which ones did you hear?
I really can't answer that. I don't know what you'd have to give me an example.
You said that when Mr. O'Keefe was first incurred his injury, you think that he was unconscious?
Yes, I think that the severity of the impact made him immediately unconscious.
So if hypothetically Mr. O'Keefe incurred his injury sometime around 12:32, is it your opinion that he never moved again until he was moved physically by somebody else?
Well, I don't know the exact time that he got the injury on the back of the head, but after that time, he could not carry out any purposeful activity.